Hi, y'all. It's Bridget Cutshaw with Real Things Living. Today, my guest is Fungai. She is in the UK, and like many women, she wears a lot of hats. Can you introduce yourself?
Hi, thank you for having me. I am Fungai Ndemera. I'm a UK-based entrepreneur and an investor. I would like to chat with you today on this podcast, and I'm so excited because at least we can chat all things living, all things women. And my areas of interest is health tech, health inequalities, how we can address them, and how we can have conversations about healthy living. So thank you so much for having me.
Oh, you're welcome. And I'm glad we connected on LinkedIn. And I think it's so important what you're doing is to people don't realize the things they do, the choices they make, everything affects their health in some shape or form. And you do have to have some time for yourself as well. And I thought it was kind of funny. You wear a lot of hats, and so do I. But I think I liked what you're talking about health tech. That is so important in life. We have lots of changes, and in the tech aspect is affecting health. Can you share a little bit? Is there a particular project that you're passionate about at the moment? That would be kind of cool to talk about.
Yeah, so isn't it amazing that technology has existed for over a long time, but up until COVID, we didn't realize that healthcare could be accessed really easily every day via technology. And I think I've been developing health tech solutions for the last 7 to 8 years. And up until COVID happened, we were having real challenges discussing how these solutions were so useful with decision makers because I think right before COVID or before the pandemic, people didn't realize that actually healthcare could be delivered via technology. And I am into us making sure that we manage our health and take care of ourselves to reduce the need for us to go and see doctors. And so it was interesting what happened with COVID. It literally ushered us into that space where we suddenly realized that we couldn't access healthcare any other way besides having to use the tools around us, which we've always used all the time, but we didn't have that realization. So my area of interest is as we are going digital and everything is going into remote healthcare access, accessing our doctors and our hospitals via digital tools, what work is being done to make sure that health equality and health equity is made, is all available for everyone, especially, well, when we talk about in the UK, we are looking at the racially diverse communities and the underserved communities. How are we making sure that as we go digital, we are not going to make it worse or worsen the already existing health inequalities that exist, right? So for me, this is an area of passion because if we are not conscious to that, it means that people who were having difficulty accessing health before and the inequalities and the disparities we have are going to be widened. So my role in the UK and the technology solutions that I'm kind of focusing on is making sure that nobody's left behind. And we are conscious to the fact that health matters for everyone. So how do we make sure everybody is included, basically? Yeah.
I like that. It's so true. I didn't think, well, people have said that like the people who are, I shouldn't say poor, but like in the US, they have less access to digital. Uh, um, I don't know, how do you do it in the UK? Is it like a public space they can go into to talk to a doctor digitally? Does that make sense?
Yeah, so in the UK, we've got the National Health Service, and healthcare is available for free to everyone.
Right.
But the accessibility piece is another area where that's how the everyone of it probably fails to access the health, even though the healthcare, even though it's available to all of us, because of other complex issues that pre-exist in the spaces that we operate. So, for example, in the UK, we already have from the project that we did during COVID in 2020 going into 2021, the ethnic minorities were dying the most, more than their white counterparts. And when we did our survey in our project, which we literally did an Innovate UK funded project where we were saying we wanted to support people who were diabetic and hypertensive to make sure that they had access to healthcare, even though we are in COVID. So we were distributing free BP machines and free diabetic machines for them to monitor their health while they are at home, so that if there is risks, when they realize that they have got higher blood pressure or high blood sugars, they can then access a clinician via the app to say, I've just checked my blood pressure, but it's high. So what do I need to do? So that they are not left not to do anything about it, and the case gets worse, and then it costs the NHS more money. So that's one good example I can give you. So when we did that project, we actually found out that the racially diverse community do not trust the mainstream system. So even though services are available to them, but they don't trust the fact that these services are available, and they don't trust that these services are going to serve them in a way that is going to make sure that they receive a good service. So they sometimes make choices not to access the services, even though the services are there, right? And so the gap that we are now occupying is through our platform. It's a one-stop AI-driven platform, Checkup Health, where they can come because they can trust and connect with the platform. They can access culturally competent, linguistically competent practitioners whom they can speak to in their languages, and then they can access the service. So they can be included, basically. So those are some of the issues that we've come across. It's quite interesting, and I don't know how it is in the US, but that's how it is in the UK.
Well, it sounds like you're more generous over there. I mean, I'm fortunate that I have like health insurance through my husband's company, and we have a little different here. And yeah, that's really great that they're offering the machines like for diabetes. That is, as we age, people tend to get like pre-diabetic and type 2 diabetes, and a lot it has to do with their diet, with their access to the food that they have. And I think people who are poor, they tend to can't afford, at least here, and it's expensive. Food is expensive, right? And I think that's all related. And I love the idea that you have the machine to be testing people. And then I would think the healthcare system has access to that data. That's what you're saying. And then
exactly.
And then red flag, if something's red flag, they'll reach out to the patient, right?
Yes. So if, for example, you have been monitoring your high blood pressure and your blood sugar, if there is anything that is outside parameter, our platform in our app allows that to be flagged to a clinician. So a clinician can then contact you and say, hey, we've received this message. Is everything okay? Or can you do this? Or then you have a consultation, which means that we have prevented a fatal incident happening. We've saved life just by allowing people to be more conscious, number one, and to have the tools they need to monitor their health. And then I guess we are also working in collaboration with culturally competent service providers who can also maybe do the basic things like educating the community and say, this is how you look after your diet. If you are predisposed to being diabetic, you could be doing 1, 2, 3 for you to reduce the risk of you even getting it, right? So again, we are creating a platform where people can access safe information that they can trust, and then they know that they can consume this information in a safe way, and hopefully they can listen. So it is a process, conscientizing everyone around these topics, but you find that these are the things that I think as humans, until someone conscientizes us, we can take our car to an MOT. We know that a car can go to service, but we are not conscious that our bodies need service, right?
Yeah.
I don't know, for some reason, we're just not conscious to it.
Right. It's like changing your oil on your car on a regular basis, right? That's kind of what it is. I like you brought up the word trust a couple times. And I think that's in the US too. People just don't trust the healthcare system here either, I don't think. And even me, like I said, I'm lucky to have insurance, but there's certain things that they pushed on me, right? Because I've had some weird health issues, but it's related to environmental, right? From my when I was a child. But you got to me, be able to at least I can choose my doctor, right? You got to be able to trust them. And if you don't trust, and that, I think what you're doing is allowing that to ferment or to grow. Couldn't think of the right word. Just trying to help people is so important. And I think in the US, the healthcare system is more about profit. That's how it is. That's how it's perceived here. And that's why the UK is probably a little bit different, but the trust factor is just, I don't know, authoritative, maybe. Is that the right word?
Yeah, and I think these complex issues, they go back a long time, and I think they are built into people's thought processes over a long time. So if you look, I did some work around why people were resisting, for example, the COVID-19 vaccines, and why were we getting more resistance in our communities, again, people who look like me, the ethnically diverse people. And you realize that even when I brought the conversation home to speaking to people like my mom, her resistance was based on her past experiences with the health system and her past experiences with things like vaccines. And so she would have gone through a patch in her life where things like vaccines have been used against a group of people.
Yes.
And now there is a real need why they must have it, but because they don't have that trust, it just comes and boils on to, no, they resist, right? But it's about understanding, how do we go beyond the resistance? And we need to understand why they are resisting. So part of the project that we did was just really doing surveys into understanding, why was there resistance? And so the key factors that we came up with, like I've said to you, was mistrust of the system. And number two, religious and cultural beliefs. My mom was simply saying, she's a good example, because she would say, no, because God is going to heal me anyway. I don't have to worry about, these things. So now it means in our platforms, when we are now creating our platforms, we are taking time and making our AI look at people's religious beliefs as well as their cultural beliefs as part of the as part of the assessment process. Because if you are going to look after someone and you don't understand their cultural beliefs and their religious beliefs and what barriers exist, you are going to miss on the diagnosis, or you're going to miss on the reasons why they are thinking the way they are. So you are going to help them. So sorry, you would improve your help, how it's going to benefit that person if you understood these pre-existing issues or factors.
You would know how to communicate with them, right? Because your language, how you're talking to somebody, will affect what they're going to think and what to believe, and you could communicate properly. And to be honest with you, I think too, people they read all these different opinions too, and so that makes people scared. At least here in the US, I'm scared. And I was a little nervous at first, but I got the COVID vaccine. And just because I try not to read too much headlines, could have just but we didn't know what was going to do, because I have a rare brain tumor. So we didn't know how my body was going to react, but it actually made me feel better in that. So I needed the T cell. I can't forget what it's called. But my mother, thankfully, my mother did it, right? She's in her 80s. And everybody in my family did it.
Yeah.
So but there's different vaccines. I think that's what was scaring people, right? And so I had to go with what my doctor, I had to go for a certain brand based on my health history, if that makes sense. And so that was, I don't remember which one I took, sorry. It doesn't matter.
Yeah, but can you see how your decision-making process, can you see and look at people who contributed to your decision-making process?
Yes.
Your doctor was part of those people,
He
right?
helped me. He knew my history. We developed trust just because he's someone I'm one of those people, because I'm able to do this. I research what doctors, the backgrounds, and that's what I do. And this guy was very well known in his field, endocrinology, right? And he's also a professor. But I trusted him, and he said, you need to do this. But he told me another one, some other vaccine that was recommended to me, I don't remember, for me not to do it, just because he knows his background is in endocrinology, how that's going to affect me because I've had, and that's why, but I developed trust over the years, but it did still scare me. And I was honest with him. I don't, and then I just can imagine in being in a community where you don't have access, and that the fear probably doesn't help and adds to your stress, right?
Absolutely, absolutely. And then if you think about it as well, is people make their health decisions based on trust and based on understanding and information, how it comes to them, right? So we are also looking at, as we go into the digital space and information is available, how is information brought to those who need to benefit from it, and what methods, and does it communicate to them? Is it written in a language that they will understand? It's those things that we take for granted, but actually they help in the decision-making process, especially when it comes to people's healthcare.
And people just think they're talking to the same person all the time. And just like I'm in the US and you're the UK, I understand what you're saying, but then that's why I'm asking a couple of clarification. It's just, I think what's good about in Europe is you do have the national healthcare system, where that's our issue here. People think it's bad. And I think because there's just some distrust at a certain level with authority, and that's kind of what it is here. And so they're being rebellious. I'm rebellious too, but not about my health, and I don't want to hurt other people, right? That's how I look at it.
Yeah, but I think that the common theme though is that with regards to our health, it's very important for us to reduce the need to want to see a doctor in the first place if we could be more proactive with our lifestyle and with our diet and with our activity. Just the way we look after our cars, to say my car has to have oil and to go to MOT and stuff like that. You will realize that actually the need to go and see a doctor wouldn't exist, or even if it existed, but you would reduce the need.
Right.
And so, yeah, and so from the UK perspective, we are seeing that while the healthcare is free, but the practitioners who look after us, they are diminishing because they are working under a lot of pressure. We call them GP practitioners. So they are working under a lot of pressure. That one GP, in the last 5 years, he has to now see ×5 the number of patients that he was supposed to see 5 years ago.
Right.
Where he has to see the same number of patients ×5 this year, right? So because of that, not a lot of doctors are wanting to now be in the profession.
Right. So, I was just thinking that we have so many, our populations are larger. You don't want, because of the stress of the doctors. Think about I have 2 uncles in France who are doctors, and it's one of them in Miat. I think he runs a hospital there, and the other is I can't remember the city, but it doesn't matter. But yeah, they work for the government. But the one in Miat is a little bit more stressed, I think. But right, none of my cousins, there's not, only one is in healthcare, one, and she's a dentist, right? And it's too stressful. And I think it is. I don't know. I think being a dentist here in the US is rated as being the most stressful for a doctor. I don't know how it is over there.
Exactly. So here in the UK, we have approximately we currently have, I was just looking at the stats because I was doing a report actually not so long ago. So let me look at the stats. So 51% of GPs, a report published a few months ago, said that they are currently suffering from depression, anxiety, stress, and burnout, and they're emotionally distressed, and they don't want to be in this profession anymore. If 51% of doctors are saying that, that means that if we don't take care of our health, even as much as healthcare is free, we don't have the practitioners to look after us in the first place,
And I
So
got chills with you saying it. It gave me chills because and same with I don't know why it is. It's the pressure from the roles, like you said, seeing too many people, they're not getting any rest and they're more likely to make errors, right? If they're fatigued and tired. And the whole thing is, yeah, I call myself a health advocate just because I talk about the um taking care of, exercising and moving and what you eat and sleep. And then they figured out what with me, with what was going on with me, they figured out it was exposure because I'm one of those people. I ask a lot of questions. Like I want to get to the root cause and find that's my personality.
yeah,
And but they're like, yeah, we don't because some of the doctors when brain tumor was discovered, they didn't know what to do here in Atlanta. They didn't have any like so anyway, they believe it was exposure to radiation. And that's why the environment stuff is I was a kid and that's why it grew slow. But and that's why they like when I come in because I'm an anomaly. I'm sure there's a lot of people like me. I take care of myself. You need people to help me when things come up. So I just think it should be more of a healthcare. We should all take care of each other. And I think access to, I like the AI. I think the machines you're talking about is so important. We should also make sure people have access to the right kind of food so they won't have to be in the diabetic situation. And a lot of it is not environmental either, right? One of my good friends, after her second child was born, she became type 1 diabetic.
yeah.
And that's something that was nothing to do with her environment. So you just don't, and she complains about, I should say complains, but she's fortunate they caught this and then she's on new technology to help monitor that for her.
Absolutely.
I'm sorry, blabbing.
Yeah, no, I was going to say, I think that, so for us, the work that we are doing as well is just through our platform, right? You can access healthcare, you can access knowledge, you can access literature, just for you to be aware of what type of a person are you. So for example, for myself, my father and my father-in-law passed away in 2004, a week apart from undiagnosed diabetes. And they were both non-hypertensive patients. So that has stirred me to be able to do the work that I do now, because that's part of my big why I do what I do. But also, it has made me conscious to the fact that I am predisposed to these things. And so because I am predisposed, what lifestyle do I need to live? And my life choices are based on things that I know that I'm predisposed. So the food choices I make, the lifestyle in terms of exercise and stuff like that, I am doing what I can within my power to make sure that I don't increase the risk of me having those things, right? And I think that's the biggest piece I think that we could all work towards or emulate in terms of being conscious to what we are predisposed to and then take action against it.
And the like my father, he died of stomach cancer, but from Agent Orange exposure because he was a Vietnam and veteran, whatever. So that's what when he passed away. And so they're thinking I was probably exposed to radiation being around military bases, right? I mean, I was a brat. I mean, we call them military brats. I was a little kid. And back then, yeah, I love that the lifestyle thing. Like, that's why I got checked too. And the cancer came up too. And it's all like, what's going on? But it was a brain tumor that was causing these other things we didn't know I had it. But it's not a history of that in my family, which is weird. But I believe in lifestyle, doing the right thing for you. I did, by the way, see a doctor that, what's the word? I was having stomach issues and it turned out to be, I was a dairy allergy to casein protein, right?
Mm-hmm.
The other doctors were checking, they didn't know what it was. I didn't have celiac disease. I cut out dairy. I can have eggs, and it made me feel, it's just really weird how your body, as we age, especially, I think if you get more sensitive to stuff. and then that'll make your body work overtime to try to fight something. That's
Wow.
there's a book called The China Study. Did you hear? Have you ever heard about that book?
No, I haven't. I'll be more than happy to.
Yeah, I would check it out. It's what it is. And I'm part Asian too. Okay. And Asians have an issue with dairy,
Right.
but they just genetically, I guess because of their culture, they're not exposed to dairy like we are in the Western part of the world. Right. I'm not saying that's what it is, but it's just kind of interesting. It's called the China Study, and that they did how people who do consume a lot of dairy, especially, they are more likely to develop cancer. And
wow.
Yeah, it's really interesting. And I learned about all this stuff because I went through after the brain tumor stuff. I did health coach certification about nutrition to make sure I was helping myself heal. I wanted to make sure I'm one of those. Like I said, I'm a deep diver, and it helped me understand everything. And like, wow, this makes sense. And I just want to be, everybody thinks I'm a good role model. That's what it is. You got to be a role model too, and not tell people what to do, but just to see how you can recover.
Absolutely. So I really agree with you on that. And I was going to just say that as well to add. So I think when you go to work and do the work that we do in digital health, it doesn't feel so much of work anymore, because every day we discover and learn new things, through the work that we are doing, and you discover that, oh my gosh, I can improve my lifestyle here. I can change here and I can improve here. And then we are all working towards better health, because at the end of the day, we live our lifestyle. It just scares me to think that we just believe that on the day that I need a doctor, that doctor must be available for me. But actually, we have a responsibility to take control of our health. So it's about us taking control of our health and taking responsibility. And then so that we reduce the pressure on those who have gone to study to look after us. And when we need help, they will be available for us to look after us.
Right.
Because they also need to be healthy. And
I was going to say that they need to be healthy to be able to help you properly. And it's just amazing, the circle that we're in, and we need to take care of ourselves. It's our responsibility, and not to expect to pop a pill to make you feel right. You have to do that's necessary in certain cases, but you want to prevent that. Prevention is key. And I think what you're doing is great. How to use health tech to help people be more proactive. Is that, or proactive and preventative, right?
Absolutely. So people need to take control of their health and take responsibility. So monitor your health as much as you can, change your lifestyle, access the help when you need to, and learn to choose, make your choices, and then trust the system, but really take control. Let's be responsible. So yeah, thank you so much for having me.
I like that. So where can people learn more about you online?
Oh, thank you so much. So I'm on LinkedIn, actively connecting with other entrepreneurs and other investors. Fungai Ndemera is my name, and I use the same name. I run my YouTube channel, which I do videos for people interested in entrepreneurship and resilience and motivation. And I'm on Instagram as well, Fungai_Ndemera, and sharing the same messages, just to be an inspiration and motivation, but really encouraging everyone to take control of our health. I do have a website, www.fungaindemera.org, where I share work and things that I'm passionate about. So yeah, thank you so much.
Cool. And for the listeners, I'll have those links in the description of this podcast so that you can just click on it. And I so appreciate your time, and it's so helpful. I'm really so happy that you are trying to help people. It's just, and you're being a great role model too.
Thank you so much, Bridget.
So important. Thanks again for listening, everybody.
Thank you.